Did you know that up to a third of the entire world's population is affected by a condition that often just hides in plain sight? It usually masquerades as simple, everyday tiredness. So today, we're going to pull back the curtain on iron deficiency and uncover the really profound story it tells about our bodies, our minds, and of course, our energy. Look, we've all had those days, right? The ones where you feel completely wiped out, like the weight of the world is just on your shoulders. But what if that exhaustion never really lifts? What if it's this constant, nagging fog that you just can't seem to escape, no matter how much you rest? Well, that is where our story begins. So before we dive into all the microscopic science, let's just talk about what this actually feels like. How does iron deficiency show up in our daily lives? What are the signals our bodies are trying to send us? Well, the signs can be surprisingly all over the place, but they often paint a pretty consistent picture. Of course, you've got that crushing, bone-deep fatigue, but you might also feel dizzy or a little lightheaded when you stand up too fast. Maybe you notice your skin is paler than usual, or you find yourself totally winded after just climbing a flight of stairs. Even things like frequent headaches or brittle nails can be your body's little alarm bells going off. This quote from the Cleveland Clinic really just hits the nail on the head. This isn't about feeling a bit sleepy in the afternoon. No, this is a level of exhaustion that actually gets in the way of your life, making it a real struggle to do even the most basic things. So what on earth is happening inside our bodies to cause this massive energy drain? To find that answer, we need to zoom in. Way in. We're going down to the microscopic level because the big clue to this whole mystery is hidden deep inside our bloodstream. Okay, so when iron deficiency gets really serious, it can lead to a condition called anemia. Now, anemia isn't exactly a disease itself. It's more like a critical warning sign that something's off. At its core, it means your body is basically being starved of oxygen because there's a problem with your red blood cells, or with the super important iron-rich protein they carry, which is called hemoglobin. And this right here, this is the aha moment. This is what doctors are seeing under a microscope. When your body is starved of iron, it just can't make enough hemoglobin. And because of that, your red blood cells actually become smaller, that's the microcytic part, and paler, that's the hypochromic part. They are literally under-equipped for the job. And this lays it out perfectly. On the left, you've got these vibrant, healthy red blood cells just packed with hemoglobin, ready to deliver that life-giving oxygen everywhere. But on the right, you see the real impact of iron deficiency. The cells are smaller, they're paler, and their ability to carry oxygen is just tanked. This oxygen shortage, that's why you feel that deep fatigue and shortness of breath. Your body is running on empty. And listen, this is not some rare, obscure thing. Anemia affects up to 1/3 of the entire global population. That's huge. Women of reproductive age and young children are especially at risk. That is just a staggering number of people living with a constant energy crisis inside their own bodies. So, this brings us to the big question. Why? Why does the body run so low on something so vital in the first place? Let's do a little investigating. So when researchers looked into patients with this specific kind of anemia, the one with the small, pale red blood cells, they found a prime suspect. This chart from a 2016 study shows that pure iron deficiency was the #1 cause, making up almost half of all cases. The next most common culprit was something called anemia of chronic disease, which is where inflammation from other illnesses makes it harder for your body to use the iron it has. So it really boils down to two main pathways. First, you've got inadequate intake. Pretty simple, you're just not getting enough iron from your food. The second is increased loss, which is usually through bleeding. For millions of women, this is connected to menstruation, but it can also be caused by more hidden issues, like internal bleeding from ulcers or even after a major surgery. But here's the thing, this oxygen shortage, it doesn't just exhaust our muscles, it starves our brain. See, iron plays an absolutely critical role in healthy brain function. And when you don't have enough, our ability to think clearly can take a major hit. Now check this out. A study compared young women who had iron deficiency anemia to those who didn't, and the difference in their cognitive performance was, well, it was stark. You can see from the orange bars that the iron-deficient group had way more trouble with things like attention span, doing simple calculations, and with their memory. This right here is that frustrating, awful brain fog that so many people talk about. Okay, so we've seen the symptoms, we've seen the cause under the microscope, and we've seen the hidden toll it takes on our minds. But here is the really good news. This is a well-understood and often very treatable condition. So let's walk through that path to recovery. The whole journey starts with a simple chat with your doctor. If you think something's wrong, they'll probably start with a complete blood count, a CBC, just to check the size and number of your red blood cells. From there, they might do that blood smear we saw earlier, literally looking at your blood under a microscope, and then order specific iron tests to see exactly what your body's iron stores look like. For a lot of people, especially with the most common type of anemia, the treatment is surprisingly straightforward. And honestly, it's incredibly empowering. It often starts with what you put on your plate. You can literally eat your way back to better health. Building an iron-rich diet is just a fantastic first step. We're talking about delicious, vibrant foods, leafy greens like spinach and kale, hearty beans and lentils, lean meats and fish, crunchy nuts and seeds. A lot of breakfast cereals and breads are even fortified with iron. Now, of course, for some people, a doctor might also suggest an iron supplement to help build those stores back up more quickly. And all of this brings us full circle, right back to where we started, the human experience. Because the process of recovery, it isn't just about numbers on a lab report. It's about getting back the energy and the vitality that iron deficiency steals from you. If there is one single thing to take away from our explainer today, please let it be this message of hope. Feeling constantly tired, totally drained, it might be incredibly common, but it does not have to be your normal. Understanding the cause is the first and most powerful step you can take. So I'll leave you with this one last thought. Your body is always communicating with you. That nagging fatigue, that inability to focus, it's not some kind of personal failing. It's a physiological signal. Your energy level is telling a really important story about your health. The only question left is, are you ready to listen?